Oxygen is inhaled into the lungs and diffuses into the bloodstream. It binds to hemoglobin in red blood cells and is carried to tissues. In the tissues, oxygen is released and enters cells for energy production. Carbon dioxide, a waste product, is exchanged for oxygen in the lungs and exhaled. Welcome back to our channel. As always, the information in this video is for educational purposes only, and does not construe medical advice. Today, we're going to talk about a crucial topic: signs of low oxygen levels in your blood. Oxygen is vital for our bodies to function properly, and recognizing these signs can help you identify potential health issues. So, let's dive right in. Low oxygen levels, also known as hypoxemia, can be caused by various factors. Some common causes include high altitude. At higher altitudes, the concentration of oxygen in the air is lower, which can result in lower oxygen levels in the body. Lung-related conditions. Chronic obstructive pulmonary disease, COPD, asthma, pneumonia, and pulmonary fibrosis can impair the ability of the lungs to effectively take in oxygen and release carbon dioxide. Anemia. A decrease in the number of red blood cells or a decrease in the amount of hemoglobin in the blood can reduce the oxygen carrying capacity. Smoking. Smoking damages the lungs and decreases their capacity to take in oxygen. Environmental factors. Exposure to pollutants, toxins, or smoke can hinder the availability of oxygen in the air. It's important to note that low oxygen levels can be a serious medical condition and require prompt evaluation and treatment by healthcare professionals. Here are some signs of low oxygen in the bloodstreams. Sign number 1. Fatigue or weakness can be signs of low oxygen levels. Hypoxia. Inadequate oxygen affects energy production and cell health. When oxygen supply is insufficient, the body diverts it to vital organs, leaving muscles with less oxygen. This impairs glucose breakdown, causing low energy, fatigue, and weakness. Hypoxia can result from lung, heart diseases, anemia, high altitudes, or respiratory conditions. Brain function is also affected, leading to cognitive issues and weakness. If experiencing persistent fatigue, weakness, and other symptoms like shortness of breath or dizziness. Sign number 2. Blue or pale skin, known as cyanosis, is a visible indication of low oxygen levels in the blood, a condition called hypoxemia. Inadequate oxygen saturation causes the blood to appear darker and manifests as a bluish or pale discoloration, primarily in areas with thin skin. Cyanosis occurs when hemoglobin, the oxygen-carrying protein, carries less oxygen. Hypoxemia can result from lung or heart diseases, circulation problems, respiratory conditions, high altitudes, or acute events like asthma attacks or pulmonary embolisms. Rapid or shallow breathing can indicate low oxygen levels in the blood, hypoxemia. When oxygen is insufficient, the body responds by increasing the respiratory rate and taking quick, shallow breaths. This compensatory mechanism aims to enhance oxygen exchange in the lungs and improve oxygenation. However, rapid or shallow breathing can also have causes unrelated to low oxygen levels, such as anxiety or exercise. If accompanied by symptoms like shortness of breath, dizziness, confusion, or skin discoloration, seeking prompt medical attention is important. Third sign: air hunger, also known as dyspnea, can indicate low oxygen levels in the blood, hypoxemia. It is characterized by a feeling of breathlessness or not getting enough air. Hypoxemia can be caused by lung diseases, heart conditions, respiratory disorders, anemia, or carbon monoxide poisoning. In these cases, the body struggles to adequately supply oxygen to tissues and organs, leading to air hunger. It's important to differentiate hypoxemia-related air hunger from causes like anxiety or physical exertion. A fast heart rate, called tachycardia, can be a sign of low oxygen levels in the blood, hypoxemia. In hypoxemia, the body responds by increasing the heart rate to compensate for the insufficient oxygen supply. The faster heart rate aims to enhance blood circulation and deliver oxygen more rapidly to vital organs. However, tachycardia can also occur due to factors unrelated to low oxygen levels, such as stress or physical activity. If accompanied by symptoms like shortness of breath, dizziness, chest pain, or skin discoloration, immediate medical attention is advised. Fourth sign: heavy legs. Low oxygen levels can contribute to muscle fatigue and weakness, which may lead to a sensation of heaviness in the legs. Inadequate oxygen supply affects the muscle's ability to generate energy efficiently, resulting in decreased muscle function. Causes of low oxygen levels include lung diseases, heart conditions, anemia, and respiratory issues. Other factors unrelated to oxygen levels, such as muscle strain or circulation problems, can also cause heavy legs. Fifth sign. Confusion or disorientation can be signs of low oxygen levels in the bloodstream, known as hypoxemia. When oxygen supply to the brain is insufficient, cognitive function can be affected, leading to confusion, disorientation, and mental fog. Hypoxemia can result from various factors like lung diseases, heart conditions, respiratory disorders, or anemia. Inadequate oxygen delivery to the brain impairs cognitive abilities, causing difficulty concentrating, thinking clearly, or maintaining mental alertness. It is important to note that confusion and disorientation can also arise from other medical conditions or factors unrelated to low oxygen levels. Chest pain. If you experience discomfort or tightness in your chest, it could indicate a lack of oxygen reaching your heart muscle, which should never be ignored and requires immediate medical attention. It's important to remember that while these signs can be indicative of low oxygen levels, they may also be related to other medical conditions. If you notice any of these signs, it is crucial to consult a healthcare professional for a proper diagnosis and appropriate treatment. We hope you found this information valuable. If you did, please give this video a thumbs up and subscribe to our channel for more informative content. Take care of yourself, stay vigilant about your health.